Assalamu alaikum and good morning to one and all. Today we'll start with a new chapter, that is general anesthetic. I am Sheikh Abu Sufyan. Welcome you to my YouTube channel Pharma Learning Forever. At the end of this e-learning session, you are able to discuss pharmacology of general anesthetics, describe theory and different factor affecting induction and recovery of the general anesthetics, explain the stages of the general anesthetics. So let's start with the first part, that is definition and cardinal features of general anesthetics. So we'll see first the definition of the general anesthetics. So what do you mean by general anesthetics? So these are the drug which produces reversible loss of the sensation and consciousness. So very important thing that you must remember is, so there is a loss of sensation and consciousness, but it is the reversible in nature. And the ideal general anesthetics are one where you can control this loss of consciousness. So you must able to control this loss of consciousness, and if you can do that, it means those are ideal general anesthetics drugs are. Okay. Now let's see what are the different cardinal features of the general anesthetics. Means what are the different ideal feature of general anesthetics. So just give me a time, I will be coming back within 2 seconds. So there is some electricity issue here. Let me sort out and come back, okay? Okay, so I'm sorry for the interruption. So we are seeing about the cardinal features of the general anesthetic. So the cardinal feature, it is nothing but the ideal features of the general anesthetics. So let's see what are the different ideal feature of the general anesthetics. So the first ideal feature, it must be, it should produce the loss of all sensation and especially the pain, because if you want to do the surgery and if he is doing the surgery, then at that time if there is pain, then what will happen, that patient will struggle, right? And that struggling will lead to disturbance in the process of the surgery. So very important feature of general anesthetic, it must be, it produces the loss of all sensation, especially that is of the pain. Second important cardinal feature is, it should produce the sleep and the patient must be completely unconscious, and it should produce the amnesia. Now obviously the when there is sleep, then only you will able to perform the surgery. That patient will cooperate you and allow you to perform the surgery, because he is completely sleeping, he is not aware about what is happening with his body. Okay. Second important thing is that, suppose if you have conscious sleep, then in such case also, like suppose if you have consciously sleeping, then if I am pricking the needle, then as a reflex action, what you will do, you will remove your hand. So wherever I am pricking the needle, that part you will remove. So there is the automatic reflex action, right? Because you having conscious sedation. Now what here we expect that the general anesthetic also produces the amnesia. Amnesia means it should produce temporary loss of memory, where what was happened with his body, what was done with his body, he should not able to recall those events. Even though he get up or he open his eye, but he should not able to recall those events, because those events are not very simple events. Sometimes he may see someone is cutting his hand or giving the stitches, so he will not able to tolerate those things. So ideal general anesthetic should produce both the sleep as well as the amnesia, that is temporary loss of the memory, right? Third important feature that is required is, the general anesthetic should produce complete immobility as well as the muscle relaxation. So complete immobility you expect, especially when you are going with a major surgery or the crucial surgery, like you are going for the bypass. So in bypass, if sometimes suppose you are given general anesthetic and patient in between become it is the anesthesia getting reversed. If that is the case, then there could be some mobility will be there, and it may lead to some bad consequences. You may do some wrong procedure, right? Or it may disturb the surgeon while doing the procedure. So once surgery is started, the surgeon must expect that there is complete immobility, right? And muscle relaxation. Why muscle relaxation is required? Because you are going to give incisions. आप उसके स्किन को कट करोगे और you are going to cut some part of the muscles. So if those muscles are completely relaxed, then giving those incision become very easy. So you can easily give the cuts at the different parts of the body because your muscles are completely relaxed. Okay, so this is the third property of general anesthetic, that it should provide complete immobility and it should also able to provide proper muscle relaxation. Okay, next one, it should abolish both somatic as well as autonomic reflexes. Now what is somatic reflex? Now suppose if you are sleeping and I have kept your hand on hot plate, now what will be your natural response, somatic response? You will be immediately removing your hand because there is a hot sensation although you are sleeping, but instantly you will be removing your hand. So this reflex, it is due to your somatic nervous system and it is due to the somatic reflex. What is autonomic reflex? Suppose something goes into your throat. So what is natural response of your throat? There is the coughing, right? There will be the salivation. So salivation, it is controlled by your autonomic nervous system. Likewise, the heartbeat, it is controlled by the autonomic nervous system. So all those reflexes essentially which is related to the movement, it must be at least abolished by your general anesthetics. So these are four important cardinal features of the general anesthetic. But remember that there is no such single drug which can be given to the patient and which can produce all these ideal properties. Okay, so what you are doing, so to achieve these all cardinal features or ideal property of the general anesthesia, you are giving combination of inhaled anesthetics and IV drug, and we'll see what is the logic behind giving this combination of the drug and what combination it is to be selected and when it is to be selected. So as we are going ahead with the pharmacology of general anesthetics, so we'll be covering that part of the drug. Okay, so this is about the definition and cardinal feature of the general anesthetic, and as a pharmacist you must be aware of this. Okay, next part, it is how do general anesthetic work, what is theories behind anesthesia. Okay, so to understand that or to understand the working principle of the general anesthetics, you must know the different theories of anesthesia, because the general anesthesia or the working principle of the general anesthesia, it is the great mysteries of the neuroscience. It is still not completely clear. Okay, there are some theories based on those theory you can say this is what happening, but there is no complete there is no complete idea or exactly what is happening at the molecular levels and inside the body. It is not completely known. Still research it is going on, and people they propose the theories, and yes, these theories are relevant also, right? And based on that we try to say that yes, this could be the mechanism of action of general anesthetics. Okay, so there are two important theories behind this. So first theory, it is the lipid theory. It is also called as the Mayer-Overton observation. And second theory, it is the receptor agonist theory. So let's try to understand the working principle of the general anesthetics based on these two important theories. So first theory, it is the lipid-Overton theory, and since this theory it is based on the lipid and it is based on the observation of the scientist Mayers and Overton. So it is called as the Mayers and Overton observation also. Okay, so now what this theory says, so according to this theory, there is strong linear correlationship between the lipid solubility and anesthetic potency, which is measured in term of MAC. Okay, now what is MAC? MAC, it is minimum alveoli concentration. Now we are talking about inhalation anesthetic agent. So when you are giving inhalation anesthetic agent, you are giving it as an inhaler. So you apply it like the oxygen mask you apply, and through that mask you are giving those inhalation anesthetic agent. Okay, so when you talk about inhalation anesthetic agent, you must talk about what is minimum alveolar concentration. How much is minimum alveolar concentration it is required to produce the anesthesia? How much amount of drug that you must deliver into the alveoli of the lungs so that it can reach to the brain to produce the general anesthesia. Okay, so less is this MAC. So the minimum alveolar concentration, if it is less, okay, so what is indicate? It indicate that there will be the more is the potency. So less is the MAC, more is the potency. Okay, so and how it is depend upon? It is depend upon the lipid solubility. It means more is the lipid solubility, more will be the concentration in your alveoli, and more will be the concentration reach to your brain, and more will be the general anesthesia. So basically this is what lipid Overton theory, Mayer Overton theory says. Okay, now let's try to understand with the help of the diagram. So now you just look at this diagram where there is graph of minimum alveoli concentration. It is plotted against oil gas partition coefficient. Because when we talk about solubility of the lipid or anything which is related to oil, and since it is the inhalation anesthetic, so we are talking about oil gas partition coefficient. Okay, now if you see here, so as there is increase in oil gas partition coefficient, so if there is more is the oil gas partition coefficient, that indicate that more will be the lipid solubility. And if more is the lipid solubility, what is happening to the MAC? MAC, it is going to reduce. So concentration required to produce the anesthesia, it is become less. Okay, so suppose if there is less is the your oil gas partition coefficient. If oil gas partition coefficient is less, then what is happening to the MAC? MAC is going to increase. Okay, so there is more MAC. Okay, so if there is less oil gas partition coefficient, that indicate less lipid solubility, and if drug having less lipid solubility, their MAC become more. Okay, and the MAC, if it is more, it will take more time to produce the general anesthesia. So in simple word, it is directly related to lipid solubility. So more is the lipid solubility, more will be the anesthetic potency. Okay, so more anesthetic potency means you need less MAC, that is MAC required, it must be less. So if it is less, that indicate that the drug it is more potent. Okay, so this is what lipid Overton theory is. So in simple word, the anesthetic potency, it is directly proportional to the lipid solubility that is there as per Mayer Overton observation. Okay, but how do general anesthetic work? This is basically, it is not exactly related to MAC or minimum alveolar concentration, that is the lower concentration of anesthetics in pulmonary alveoli, which is needed to produce immobility in response to the painful stimulus. Okay, so once there is immobility is there is no painful stimulus is there, then only you can do the surgery. So if it is happening in around at least 50% of patient, then that concentration it is called as the minimum alveolar concentration. Okay, and it is directly related to your lipid solubility. But although this is the Merton observation is, but it only indicate the capacity of general anesthetic to enter it into the CNS. Okay, because CNS it is made up of your blood-brain barrier, which is lipidic in nature. So if more is the lipid solubility, so you say that more drug can reach to the brain, and if more drug can reach to the brain, it can quickly produce the general anesthesia. Okay, but this really does not indicate the mechanism by which anesthesia it is produced. So this just indicate that the how much amount of drug can reach to the site of action, but it doesn't indicate about the mechanism. Okay, I hope it is clear to you. You understood what is lipid Merton theory or lipid Overton theory. Okay, now let's see about second theory, that is the receptor agonist theory. Now as per receptor agonist theory, it says that the anesthetics may act at the GABA receptor, it may act at the NMDA receptor and some other receptor, and the action of anesthetic drug and their interaction towards this receptor, it might be responsible for the general anesthesia, right? And immobility, it is due to spinal mechanism, But again here the site it is not exactly known. At what place in spinal cord it produces the action and that is responsible for general anesthesia, it is not really known. Okay, but just remember immobility which is produced, it is due to the spinal mechanism, and action it is produced, it is due to the action at the different receptor and it's binding to the different receptor. Okay, now let's try to understand by using the receptor theory. So we know that in case of receptor, in case of alcohol chapter also you have studied that there are some receptor which produces the inhibition of the CNS, and there are some receptor, if drug it is agonist to those receptor, it produces the excitation of the CNS. So in order to produce general anesthesia, there must be inhibition of the CNS, because if you see the increase in grade of CNS depression, then first, okay, so when we say that the drug, if it's bind to the receptor, then the binding of this drug to the receptor, it produces different type of action. So let's see with the different receptor. For example, in case of the glycine, when drug bind to the glycine, then what it does, these general anesthetics, they produces the potentiation of inhibitory receptor. So there are two inhibitory receptor present in your brain. First one, it is the glycine. So propofol and inhalation anesthetics, when they bind to the glycine, it produces their potentiation. Now due to potentiation, what is happening to the CNS? There is the inhibition of the CNS. So due to potentiation of the glycine, because this is inhibitory receptor, it produces the inhibition of the CNS. So I am showing this inhibition as the sign of the decrease in CNS. Okay, so that indicate the inhibition of the central nervous system. Likewise, the second receptor, it is the GABA. We know that GABA, it is also inhibitory neurotransmitter. Binding of the drug, that is general anesthetic, to the GABA, it produces the potentiation of inhibition of the GABA. Now what is the overall action of the central nervous system? Again, there is inhibition of the CNS, because this is inhibitory neurotransmitter. So if the drug binding to the GABA and it has agonistic action, then it is going to produce inhibition of the central nervous system. So overall action, it is inhibition of the CNS. Okay, so the drug act by this mechanism. It is the propofol, it is the inhalation anesthetics. What it does, it open the chlorine channel like the benzodiazepine. It produces the hyperpolarization due to opening of the chlorine channel, and you know the detailed mechanism of that. And due to that, it block the responsiveness to the painful stimuli, which result in immobility of the anesthetic state. Okay, since there is no movement of the chlorine, your brain doesn't receive any action potential or any message from the sensory organs. So although you are giving the cut, but due to inhibition of your CNS, you have not getting message of the pain. Okay, so this is how it produces the general anesthesia. So one of the way is to potentiate inhibitory receptor. Okay, so that there is more inhibition of the central nervous system. Second way could be, there are some general anesthetic which produces inhibition of the excitatory receptor. Now what excitatory receptor does? Excitatory receptor, if agonist, if bind to the excitatory receptor, then it basically produces excitation of the CNS. So I am writing this as a increase in excitation of the CNS. Okay, now what general anesthetics they are doing? They are blocking this receptor. Since they block excitatory receptor, like the nicotinic acetylcholine receptor, which is generally seen in case of the fluorinatic anesthetic agent, due to that there is CNS inhibition. So again it contribute to CNS inhibition. Likewise, it also block NMDA receptor. For example, the nitric oxide and the ketamine, what it does, it inhibit calcium selective channels, and due to inhibition of the calcium selective channel, it block NMDA receptor. Now excitation of CNS here, it is blocked or it is inhibited. And what is happening here? Here it produces the potentiation of the inhibitory receptor. So which action it is predominant? So here inhibitory action, it is more predominant, and since there is more predominant inhibitory action is there is complete inhibition of the central nervous system, and it produces increase in grade of CNS inhibition, which lead to general anesthesia. So in simple word, you can say that it potentiate inhibitory receptor like glycine and GABA, and it produces blockage of excitatory receptor like nicotinic nicotinic acetylcholine receptor and NMDA glutamate receptor, and overall action it is inhibition of the central nervous system and which lead to general anesthesia. So this is as per the second theory, that is the receptor theory. Okay, so based on this theory we can conclude that the potency of anesthetic agent, it is first depending upon the lipid solubility. Okay, so more is the lipid soluble drug, more will be the potency of anesthetic agent. And second thing, it is depending upon which receptor it is binding. So if it produces the potentiation of inhibitory receptor, it produces more general anesthesia. Or if it produces inhibition of excitatory receptor, it produces more general anesthesia, or that drug become more potent in nature. So this is about the mechanism of action based on certain fact and theories. Okay. Now, if you look at receptor level, then general anesthetic, they act by depressing synaptic transmission. Now, what is synapse? Now, we have seen the drug produces potentiation of the glycine, it produces the potentiation of the GABA, and due to that there is inhibition of CNS. Now, how it is happening? So now suppose if this is the synapse, so that is the space which is present between two neuron. Now, if action potential, suppose if it is coming from this sensory nerve, so suppose this is the sensory nerve, if it is carrying the action potential, suppose आपने यहाँ पे उसको cut दिया है, so to feel that pain which is related to cut, the message should be carried through the synapse towards the brain. Now, suppose this is where the brain is present. Okay, so I am writing brain as a B. Suppose here brain is present, and here you supposed to give the cut. Now, if you want to reduce that pain sensation, and if you want to have complete immobility, then you must able to block the synaptic transmission. So action potential should not be transmitted from sensory nerves towards the brain, isn't it? This is exactly what done by general anesthetic. They are depressing the synaptic transmission, and due to depression of synaptic transmission, message doesn't goes to the brain. So although you are giving the cut or you are giving the incision to the body, but that patient doesn't show any pain and it does not show any mobility. Okay, so this is how how the general anesthetic work, or this could be the tentative mechanism of the general anesthetics. Okay, now let's move on to the question and answer session before going ahead with the next part of today's session. So my first question is, I want you to write your answer in the chat box. Okay, my first question is, enlist cardinal feature of the general anesthetic. I expect there are 4 cardinal features we have seen. I want you to give the answer in the comment box. So let's see who give the first answer in the comment box. Okay, so let me open your chat box. I will enlarge this chat box so that I can completely see your answer. Okay, so I am popping out the chat box. So we have seen the 4 cardinal feature of general anesthetics. So one by one, try to give answer in the chat box. Okay, very nice answer started coming. I have seen the Jihan has given the first answer. It produced the sleep and amnesia. Very good. So amnesia and sleep, it is one. Second one, Amina has mentioned abolition of somatic and autonomic reflex. Very good, Amina. Then immobility and muscle relaxation. Again, Jihan has mentioned. Very nice, Jihan. Immobility and muscle relaxation, it is one of the cardinal features. And Khan Humaira has mentioned about amnesia, that is temporary loss of memory. Okay, very good. So I can see all 4 cardinal features are covered by you. Induces the sleep, it produces the immobility, muscle relaxation, it reduces the pain sensation, and it produces the temporary amnesia. Okay, so these are 4 important cardinal features of the general anesthetic. Very nice. My second question is, what is the name of lipid theory? Very simple question. Those who have just आपने अगर सुना भी होगा ये lecture, then you should be in position to give the answer. What is the name of the lipid theory? Yes. What was the name of the lipid theory? We have seen that there is specific name for the lipid theory. What is the name for that? Let's see who is the first to give the answer. Yes, I want everyone to be very active. It must be flooded with your comments. Okay. I hope question is clear to you. What is the name of lipid theory? Okay, so first answer is given by Mohammad Aftab. It is the Mayer-Turn. It is Mayer-Overton theory. Okay, Jihan has also given the answer. Very good, Jihan. Mayer-Overton theory. Kajal mentioned that it is the Mayer-Overton theory. Very nice. Okay, so you should instantly able to give the answer. Okay, so it is the Mayer-Overton theory is a well-known theory. As a pharmacist, if someone is asked about you what is the lipid theory of general anesthesia, then it must be on your tip of tongue. It is the Mayer-Overton theory, which is something related to lipid solubility. More is the lipid solubility, more is should be the MAC, that is the minimum molecular concentration. Okay. My third question is, which receptor are inhibited by general anesthetics? So first try to understand what question I am asking. I am asking you the question, which receptor are inhibited? I am not saying that which receptor are augmented. Okay, so I am asking you specific question, which receptor are inhibited, or you can say which receptor are blocked by general anesthetics, and that contribute to the action of the general anesthesia. So let's see who give the first answer of this. So I know there is 30-second lag is there in case of YouTube live. Okay, so Sagar mentioned there is inhibition of the GABA, but your answer is wrong. GABA, it is not inhibited. It is itself is inhibitory neurotransmitter. It actually potentiates action of the GABA. Okay, so we have seen two receptors which are blocked by the this drug. So which are those two receptors? GABA is not inhibited. GABA itself is inhibitory receptor. Actually, the general anesthetic they enhance the action of the GABA. So there could be more inhibitory action. So I can see the Sufreen Banu mentioned it is the NMDA receptor. Yes, and then Jihan has also mentioned it is nicotinic and NMDA receptor. Okay, so NMDA and it is the receptor, or the which are the excitatory in nature. Okay, so NMDA, nicotinic acetylcholine receptor, which are excitatory in nature. So if these receptors are blocked, then it is going to produce inhibition of the central nervous system. And we know that the general anesthesia, it is happened due to inhibition of the CNS. Okay, so excitatory receptor, if it is blocked by the drug, like nicotinic and NMDA, these are excitatory receptor. If it is blocked, then it produces the inhibition. Whereas GABA and glycine, it produces the potentiation of their action, because GABA and glycine, their inherent action, it is inhibition of the CNS. So activation of this receptor, it produces the inhibition. Okay, I hope it is clear to you. So these are little confusing, but you should not confuse, and you must able to be in position to identify what is exactly happening at the receptor level. Okay, so now we have seen about the mechanism of action of the general anesthetics. Let's move on to the second part of today's session, that is the stages of the anesthesia. This is a very favorite question of the examiner. Every year in semester exam, or maybe every alternate year, I can say this question come in semester examination. What are the different stages of anesthesia? Okay, in detail they ask you to write the short note or detailed discussion on different stages of the anesthesia. It's very important. So general anesthesia, it causes an irregular descending depression of the central nervous system. Okay, now what is descending depression? So in case of descending depression, the higher function lost first. Okay, so what are the higher function? Now just try to recall or just try to think about what could be happening or what might be happening in case of the general anesthesia. Okay, now suppose if you are under on a bed and general anesthesia is induced. Okay, so what happens? The first your eye get closed, or first there is immobility. Obviously first your eye movement get closed, you are not able to see, पूरा अंधेरा छा जाएगा. Okay, so the higher function, that is visual, that is the vision and the speech. Okay, so these higher function they lost first, and then there is progressive loss of the lower area of the brain. So first your higher area of brain is involved, and as a result of that your higher primary function lost first, and then there is progressive loss of lower area of the brain, and due to that the lower function are also lost in your body. Okay, now let's see how it is systematically happened. So it's happened in 4 stages. So there are 4 stages of the anesthesia. First stage, when you, the moment you give the anesthetic agent, inhalation anesthetic agent, the first stage produced, it is the stage of analgesia. Second stage, it is the stage of delirium. Third stage, it is the surgical anesthesia, and fourth stage which is produced, it is called as the medullary paralysis. Okay, now let's see how this happen and how to identify and recognize these different stages of the general anesthesia. So the first stage, it is the stage of analgesia. So you must remember where it start and where it end, and what are the different symptoms by which you can able to identify that yes, it is stage of analgesia, this is the stage of anesthesia, this is the stage of medullary paralysis. Okay, so the first stage, it is the stage of analgesia. So where it start? So it start from beginning of anesthetic inhalation. It means moment you keep the face mask of anesthetic agent on the patient to whom you want anesthesia, right? Immediately the stage start, it is called as the stage of analgesia. Okay, so it start from beginning of anesthetic inhalation and it lasts up to loss of consciousness. So whatever happen in between when you have apply your anesthetic agent to the point where there is complete loss of consciousness, that stage, it is called as stage of analgesia. That is the first stage. Okay, now let's see what exactly happening at this stage. So at this stage, patient remain conscious, he can hear and he can see. So generally you call this stage as a conscious sedation, where you are sleeping. Okay, and you feel like a dream-like state. So there is feeling of the dream-like state, but important thing is that you can hear and you can see. So if you can hear and you can see the conversation of the doctor, and if you can see what they're doing with you, don't you think it is the horrible condition? Yes, it is horrible condition, and that is the reason at this stage you cannot perform the surgery. So although here there is a loss of pain, amnesia it is developed at the end of this stage, and also there is a reflex and respirations remains the normal, but you cannot do surgery at this stage. Okay, why? Because still you can hear, you can see, also the reflex action is there. So when the reflex action is there, when you are giving the incision, अगर आपको cut देना है, obviously that patient will struggle, he will remove his hand or that part where you want to do the surgery. Okay, so the reflex action is still there, the respiration it still remains normal, so you cannot perform surgery at this stage. Okay, so use it is only limited to the short procedure. So very short procedure, like suppose if you want to do the endoscopy, where you want to just insert the camera from your anal canal and you need to take the picture. So for that procedure you can use it. But if you want to really give the incision, you cannot do this at the first stage. So what is the characteristic of this stage? It's begun when anesthetic inhaler are applied, and where it end when there is loss of consciousness. And what are the characteristics? You can see, you can hear, there is dreamlike state, amnesia it is developed, but reflex and respiration remain the normal. So you are using it only for the short-term procedure. Okay, let's see about the next stage. So next stage is the stage of delirium, where it starts from loss of consciousness. So there is loss of consciousness, but here it ends till beginning of the regular respiration. So where it start with the loss of consciousness, and where it end at the beginning of the regular respiration. So what it means, after loss of consciousness or at initial stage of loss of consciousness, there is no regular respiration. There is some change in the respiration, either increase or decrease. Okay, let's see what are the symptoms, what is happening at the stage of delirium. So it is also called as the delirium. It means excitement. There is excitement of the CNS. Okay, so there is apparent excitement is seen. The patient may shout, struggle, and hold his breath. So if this stage, if it is longer in nature, then that patient may shout. Do you think it is ideal stage? No, it is not an ideal. The patient may struggle, he may hold his breath. So all these stages are not at all ideal. Muscle tone is increased. So for surgery, what is the cardinal feature? For surgery, muscles should be completely relaxed. But at this stage, the muscle tone it is increased. Third, it is the jaw are tightly closed. That is not ideal, because if you see the patient, his jaws are tightly closed. Do you think that that is the normal the posture of the person? No, you cannot see that such jaw are tightly closed by the patient. You cannot see such patient for more time. Okay, breathing is jerky. So that is what I am saying. The breathing is not normal. So breathing is jerky in nature. You may see the patient might vomit. There could be involuntary micturition or defecation. Okay, so this could be there in case of the third stage, that is the delirium, or that is the apparent excitement of the brain is there. Okay, now ideal anesthetic agents are those which having the less time spent in second stage, that is the stage of delirium, because these are none of these symptoms it is good for the patient, or none of the symptom as a surgeon you expect you want to see in the patient, isn't it? So your anesthetic agent should be such that it should your patient should spend very less time in second stage, that is the stage of the delirium, right? So ऐसा anesthetic agent होना चाहिए कि patient immediately after the analgesia immediately go into third stage. Okay, and there must be less time spent in the second stage, that is the stage of the delirium. Okay, so heart rate and BP may rise, the pupil dilate due to sympathetic stimulation. So these are all bad things. So this is the reason you cannot perform any operative procedure at this stage. Although patient is unconscious, there is loss of sensation, and the patient become unconscious, but you cannot perform any operative procedure at this stage. Okay, because these are not favorable for performing the surgery. Okay, so this is the second stage. Third stage, it is the surgical anesthesia. Now what is happening at surgical anesthesia? Here it extends from onset of regular respiration. So now if you see in second stage, there is jerky breathing. So when jerky breathing it end, and when the regular respiration it start. Okay, and after that there is cessation of the spontaneous breathing. So regular respiration is happening and cessation of the spontaneous breathing. This is the last point that indicate that the surgical anesthesia is over. So you need to maintain patient in between the regular respiration and spontaneous breathing. आपको spontaneous breathing होने नहीं देना है, because this is, if spontaneous breathing is started, it indicates that patient may be going now to the fourth stage. So you don't want to have that stage. So you need to maintain anesthesia at the stage where there is loss of consciousness and also there is regular respiration. So breathing normal होना चाहिए patient की, right? So you are maintaining the patient at this particular stage. So if this stage it is reached, then you can start the surgery. So patient here in case of surgical anesthesia, again it having the 4 plane of surgical anesthesia. Okay, and you are trying to keep patient in this 4 plane. So what are these 4 plane? Again, it was asked many times in examination. Sometimes they ask question only for 2 marks. What are the different 4 plane of surgical anesthesia? So don't get confused. So there you don't write 4 stages. Here the question it is very specific. They have asked the question about 4 planes, not 4 stages. Okay, so don't get confused. So the first plane of surgical anesthesia, it is the roving eyeball. So you will come to know whether surgical anesthesia it is induced or not. So if you just observe at the eyeball, and if eyeball become a fix, there is no eyeball movement. If that is there, so that indicate the roving eyeball. So that indicate that the patient now started with the surgical anesthesia. So this is the first plane. Second plane, it is loss of corneal and laryngeal reflex. So cornea, obviously there is a loss of the reflex of your eye. So if your eye reflex is there, and you might have done practical in the second year pharmacology where there is practical on the rabbit eye. So in the rabbit eye, if you apply the feeder, there is the corneal reflex. Rabbit will close the eye. There is contraction of the cornea, right? Here, if you want to do the surgery, there must be loss of corneal reflex. Because if अगर आपको eye का surgery करना है, then there should be loss of corneal reflex. The eye should be open, right? So the second stage, it is where there is a loss of corneal reflex. There is also loss of laryngeal reflex. So it is also called as a voice box. So since there is loss of laryngeal reflex, you may not see any voice from that particular patient. So this is the plane 2. Plane 3, it is the pupil start dilating. In case of eye, pupil start dilating and there will be the light reflex is lost. So no matter how much is light you are using in operation theatre, the patient light reflex will lost and he will not show any reflex due to the light. And very easy, and that you did in again the rabbit eye. You have applied, use the torch. When you apply, use the torch and focus that into the eye. What is your natural response? You will be closing your eye. So if you are doing that, it means your light reflex is intact. If there is loss of light reflex, you can just do the, you can just put the torch and see whether patient is opening and closing eye. If that is continue, it means light reflex is not lost. If although you have used the torch and patient eye still it is open, okay, and pupils are dilated, that indicate that this is the third stage or third plane of surgical anesthesia. Okay, so this is very good for performing, especially in case of the ophthalmic surgery. Then plane 4, where the intercostal paralysis is occur. Okay, and it is easy to identify when there is no intercostal paralysis. You can see the breathing, and due to the breathing, your chest going up and down. Okay. Now after intercostal paralysis, this movement it is slowly going down. Okay, so that is where you must identify now intercostal paralysis is going to start. Then there is shallow abdominal respiration and dilatation of the pupil. So now when you are doing surgery, you try to maintain patient between phase 1 and phase 3. You don't want to have intercostal paralysis. You don't want to have the shallow abdominal respiration and dilatation of the pupil. So this is how, based on the symptom and based on the observation, you try to adjust the dose of general anesthetics to maintain that patient at the level where you can perform the surgery. Okay, so these are the 4 plane of surgical anesthesia. Again, I am repeating, these are not stages. This is the part of the surgical anesthesia, that is third stage of the general anesthesia. Fourth stage, which is medullary paralysis. And remember that you don't allow patient to go into this stage, because this is a very dangerous stage where what is happening, there will be the cessation of the breathing and there could be the possibility of failure of circulation and death of the patient. So these are very close stage. That is the reason why during the surgery you need special anesthetician with you who can observe, who can monitor and control the level of the anesthesia to the level that where exactly patient can be maintained at the third stage of the anesthesia. You should not be on the second stage, because we have seen in second stage is also dangerous. Patient is shouting, he struggle, he hold the breath, okay, and he can hear. So that you don't want. So you are allowing patient only at the third stage, and to do that you need to appropriately control the level of the general anesthetics, and that is you are doing by using the combination of the inhalation anesthetics and the IV anesthetic agent. Okay, so I have done with my today's part. So I have used his book KD Tripathi, the page number 365 to 379. So I must thank the author of this book for providing wonderful content for this chapter on the general anesthetics. Okay, so the next quiz, again you need to answer 2 to 3 questions. So that will be released by using the Google form. So I will be releasing this Google form link in the chat box. You have to open that. So once you give that quiz, that will be your attendance, as well as it will be your quiz as well. Okay, so